I think we can start, and the last few people will will join as we go through. So good morning, everyone. Just to let everybody know, this meeting is being recorded. You will all get the recording afterwards, but it will be posted online. And our speaker for this morning is the wonderful Jonathan Hammond from the University of Manchester. And I don't want to say too much about his background because he's going to go through that as he's talking. But please, everybody, give him a very nice and warm SPCR welcome. And yeah, we'll kick off straight away. As I said earlier, we are being recorded. If anyone has any issues, please put your hand up or pop it in the chat. And if you do have any questions as we go along, there's a Q&A at the top. Put your questions in there. Feel free to add to anyone's question. And we'll be stopping at regular intervals, and Jonathan will be answering those as we go. Thank you very much, and without further ado.
Thank you, Tom. It's nice to be referred to as wonderful first thing in the morning. Hope everybody's doing okay. I'm just going to share my slides. Okay. Tom, can you see them okay now?
Yes, we can. If anyone's got any issues, you can pop it in the chat and I'll help you with your technical issues.
Brilliant, thank you. Okay, so yes, welcome everybody. Welcome to this session on communicating effectively with policymakers. I'm Jonathan Hammond. I'm Senior Lecturer in Health Policy and Organisation. I'm based in the Centre for Primary Care and Health Services Research at the University of Manchester. And I'm also a member of the HOPE research group, which is Health, Organisation, Policy and Economics, which is led by Professors Kath Checkland and Matt Sutton. So just going to give you a quick overview of what I intend to cover today. So I'm going to kick things off with a kind of quite a broad consideration of what policy engagement is and therefore kind of policy communication as part of that and why it matters or why it may matter to you. And then I'm going to focus in on some conceptual tools that might help us to kind of think through effective approaches to communicating with policymakers, particularly Kenny and Kwiatkowski's framework for effective communication. I'm going to use that to sort of structure the session and for us to kind of use that as a frame to sort of think through some of these issues. I will then kind of lead a breakout discussion where I really want to focus on your policy communication goals. I'm conscious that quite a diverse group with different priorities in different places. So I'd like to hear a bit from you about what's most salient for you, really. And then hopefully that can help us to sort of steer the next part of the session, which is more about the kind of practical guidance, some of the kind of nitty-gritty, particularly focusing on writing style, formats, channels, resources that you can use to support effective communication. And then finally end with kind of encouraging you to think a little bit about action planning and some concrete steps that you might be able to sort of take next in the process, whatever that looks like for you. So I'll start by just giving you a bit of information about my background and context so you know where I'm coming from and can kind of orientate to that. It's always a little bit imposter inducing, kind of doing something called a masterclass, but I've been involved in policy related research and engaging with policymakers for quite a long time. And that kind of started with my PhD, which was focused on the 2012 Health and Social Care Act. So it's a policy focused PhD and looking particularly at clinical commissioning groups and their status as membership organizations. So from there, I've worked on a number of different projects, often focusing on kind of organizational and governance issues within the kind of health and social care system, and particularly looking at how national policy has been implemented at local levels. I've also done work looking at kind of innovation programs like NHS test beds, and I've been involved and I'm currently involved in the Policy Research Unit for Health and Social Care Systems and Commissioning, which used to have a slightly different name. We still kind of refer to it as PRUCOM for short. I'll just jump ahead and show you what the website looks like for the policy research unit. And there are a number of these units nationally, and they're kind of commissioned on these sort of 5-year grants to do a sort of package of work really for policymaker customers. So we've got kind of communicating with policymakers really built in to the policy research units. So each project that we work on, and there's a number of those multi-year projects generally, we have a specific policy customer, and then we kind of engage more broadly with teams in the Department of Health and Social Care and NHS England, as is or was. And then we kind of focus in on what that we negotiate with them and focus in on what they're really interested in finding out about. But then we also do some responsive work for them as well. So we might be asked to kind of collate evidence in a particular area. It could be quite a quick turnaround. So we kind of have this mix of sort of slower research projects with kind of policy communication kind of throughout, and then this kind of faster, more responsive bits. We've previously done projects looking at primary care networks, integrated care systems, social care, community nursing. And through PRUCOM, we've kind of used the work that we've done to feed into evidence that we've given to select committee inquiries, written and oral. Kath Checkland's given oral evidence to select committees. We've briefed members of the House of Lords on evidence, and that's kind of ended up informing amendments, particularly to the Health and Care Bill 2021. And alongside all of that, we sometimes run seminars for policymakers on a range of issues, but things like commissioning as a concept. And that I think is quite a helpful part of what we kind of offer to policymakers, particularly the kind of more junior level of civil servants, where there's quite a lot of turnover really in those roles. So part of what we do is almost to provide a bit of a kind of institutional memory around some of these policy issues for government departments as they kind of continue to sort of refresh and evolve. So in addition to PRUCOM, I've also done work on GP Access, a policy research program grant, which is kind of built on work that my colleague, Dr. Jennifer Voorhees, developed during her PhD, which is kind of about looking at access in this particular sort of relational way. And that's more of a typical kind of research grant, but we really tried to build in opportunities to communicate with policymakers through that. It was kind of a key priority of that work. And that ended up informing the production of a set of resources and a website, which we made freely available to this optimizing access through human fit, or OATH. So this is another example really of a way that we've tried to communicate with a broad range of stakeholders actually, but including policymakers. And that's involved producing kind of infographics and animations and tools and things to try and make these concepts accessible and useful for people in kind of different decision-making roles. So I'm currently working and co-leading a post-implementation review of the Health and Care Act 2022. And that is, ongoing work. And part of that is, that was commissioned by a team in the Department of Health and Social Care via the Policy Research Programme. So again, there's quite a kind of, quite an integrated approach to policy communication within that project. But one of the things that we designed into that was something called a research update group, which kind of sits alongside the advisory group. But the function of that is for us to sort of meet regularly with policymakers, or every 3 months or so, and to kind of update them on our findings as they're being produced, so that we're trying to kind of make it relevant to them as we kind of go along, and not kind of waiting to the end of the project to sort of do the policy communication. It's sort of staged throughout. So I've mentioned some of the kind of written evidence and other things that we provided. We've also kind of contributed to the fuller stock take, which has informed some recent changes to the NHS. And in addition to that, I'm the course unit lead for the Introduction to Health Policy course unit on the Masters of Public Health at Manchester. Okay, so skipping ahead now to policy engagement as a sort of broad endeavour. I think it's probably quite useful just to go back to first principles, really, when we talk about policy itself, which is obviously a really familiar word. Everybody knows kind of instinctively what we're talking about with policy. But I just want to clarify that for me, when I'm talking about policy, it's really referring to the kind of the means by which people govern. And so it's about affecting and ordering other people in some way. And it's also about planned action or inaction. So it doesn't, you don't necessarily have to be intentionally doing something. Not doing something is also a potential policy choice, but it's about intentionality, really. That's the key thing. And then policy is kind of putting political values into practice. I think there's a very good argument that all policy is political in some way, and actually kind of understanding that kind of opens up opportunities to kind of engage with policy in useful ways. So policies are often animated through programs and strategies and legislation. And I think for me, when I'm talking about policy, I'm mainly talking about government policymakers, and that reflects my experience particularly. But it applies more broadly. And we also engage with policymakers at more local levels sometimes, particularly kind of within sort of different tiers of the NHS. There are policymakers and decision makers. But I think a lot of the principles that we're going to talk about today will probably be of relevance to policy in general. I think a lot of these things are kind of broadly applicable to people in any kind of policy-making role. A lot of you will be familiar with this idea of the evidence gap. And what that refers to is just this idea that there is a gap between the available evidence that exists and the decisions that are made in the development of policy. And what it speaks to is this kind of possibly slightly utopian kind of view of policy making as quite a rational and linear process, where there are kind of predictable stages that are kind of gone through one by one. I'll talk about the policy cycle a little bit later as well, which relates to this. But this idea that you kind of have a policymaker with a problem, and then what they do is they gather all of the evidence that exists, and then they make the best possible decision based on that evidence. And in my experience, that's really rarely how these things work. The reality of policy making is messy, it's political, so there are lots of different forces that are shaping the trajectory of policy, particularly in health and care. And so I think kind of having a sense of that messiness is also quite helpful in informing how you approach kind of engaging and communicating with policymakers. So yeah, for me, policy making is kind of messy, it's contingent, it's political, but really importantly, it's relational. And I think understanding policy engagement as a sort of relational skill is very helpful. And having that sensitivity to messiness, to politics and power is very helpful as well, because it kind of provides opportunities for approaching it in a useful way. So communicating with policymakers is really a dimension of engagement. And as I said, I think being more attuned to the kind of messiness and the institutional forces that are in play, kind of considering all of that is a very helpful approach. But really, the key thing is communicating with policymakers in some way, because you can produce the best research evidence in the world, but you won't have any impact unless there is some attempt to actually engage and communicate with policymakers. Okay. So why do it in the first place? I mean, presumably most of you have some interest in communicating with policymakers, and that's brought you here. And I think there are a range of different ways or different reasons that people might have for doing this. You can think about it intrinsically, societal impact, the kind of fulfillment that you get from it, the intellectual satisfaction and the kind of interest in seeing how things work. But then there are extrinsic kind of factors as well, resources that it may open up access to, actually influencing policy in different ways, being able to build networks. There's a whole range of things, and it's quite personal as well, I would say. So reflecting on your motivation is a useful thing to do. There's no single right reason for doing policy communication, and that reason might change over time. But I think understanding your motivation is quite helpful in shaping your approach and kind of sustaining that over time. So really just kind of checking in once in a while to kind of see where you sit in that kind of space of motivation, I think is quite helpful. Okay, I'm going to talk a bit about some conceptual tools now before I kind of lead us towards a breakout discussion. So the first one here is Oliver and Kearney's 8 recommendations, and this is a paper on the do's and don'ts of influencing policy. So this is a kind of systematic review of advice to academics for doing policy engagement. The references will be at the end of this presentation, and share the slides afterwards as well. But there's a couple of things I want to draw attention to on this list. So you can see do high quality research is the first one, and obviously that's a kind of prerequisite for a lot of this stuff. You need to have something valid and valuable to report and to say. But then there's stuff here around making your research relevant and readable, understanding the policy process. I think these are key things, and we're going to touch on these in more detail. But then there's the kind of more interpersonal stuff about being accessible to policymakers, about engaging routinely, being flexible, being humble, your kind of attitude towards them. And then stuff around your kind of your positionality and your role. So deciding if you want to be an issue advocate or an honest broker. Again, this comes down to your motivation to some extent. Building relationships and ground rules with policymakers. It's important that you kind of protect your kind of boundaries as an independent researcher, and actually your kind of credibility depends on that as well. Being entrepreneurial or finding someone who is, so that kind of idea of engaging entrepreneurially with policymakers and kind of finding ways to make links and kind of be effective in that sort of network space. And then again, reflecting continuously. So should you engage? Do you want to? Is it working? Again, this kind of reflection through the process over time, I think is a very useful thing to kind of bear in mind. But what I would like to do is to focus primarily on this framework here. So this is Kearney and Kwiatkowski's How to Communicate Effectively with Policymakers from 2017. So you've got these 7 different dimensions here. And I'm going to go through these in a bit of detail. But obviously we're taking as read in this the need to produce high quality research and to have something to say. But the way that you say it really relates to these other dimensions. So again, I think it's good to understand context as much as possible to help shape your approach. But as I said before, I think whatever level policymakers are kind of working at, that there's a good chance a lot of these things will apply. So breaking them down into more detail, firstly, understanding policymakers' context. There's a very good chance that whatever level policymakers are operating at, that they will have some level of cognitive overload going on. So being able to present research in a way that kind of reduces that load is very helpful. And you can achieve that by using kind of executive summaries, of using infographics, of using clear, concise language, however that is delivered, and trying to highlight key findings and their implications for policy. So kind of looking for solutions. Time constraints. So given the limited time that most policymakers have, I think providing brief outputs or communications, whether that is policy briefs, which again we'll talk about in more detail, but something that summarizes the most critical points, that is supported rather by kind of detailed links or appendices or something, some way of accessing additional information that isn't kind of presented up front, and reducing the kind of accessibility is helpful. And then there's framing and messaging. So research can helpfully be framed in terms of the sort of benefits to public health, to cost effectiveness, potential improvements for health outcomes, whatever the relevant aspect is of the policy. But you can frame, for example, a new vaccination program in terms of the lives that it will save or the healthcare costs that it would reduce, and those kinds of persuasive aspects are helpful to sort of to include and prioritize. Building relationships, so trust and credibility, making your credentials clear, I think is quite helpful, so that policymakers feel that they can trust what you're saying, particularly before you've sort of established a relationship with them potentially. And then engaging with policymakers early and often is very helpful. If you can build relationships through kind of regular updates, through consultations, it can facilitate this through workshops, through roundtable discussions or advisory committees. There's a whole range of different kind of opportunities for sort of growing that kind of trusting relationship over time. Engagement and interaction. So you can find ways to engage more regularly with policymakers. You can potentially involve them in the research process itself, and that's something that we do sometimes in our work. Is we may have a work stream that involves actually speaking to policymakers to try and understand, what's their understanding of a particular policy, how do they think it's supposed to work, and not only does that then kind of feed into our understanding of how to sort of conduct the research itself, but also helps to sort of establish relationships and to grow a network. And so there's lots of dimensions of value to that, really. You can run stakeholder meetings as part of outputs for a project. You can try and ask for their input on research priorities and methodologies. There's a lot of creative ways that you can involve policymakers with the research process itself. And as I've already mentioned, on the 22 Health and Care Act project that I'm involved in, we have this research update group where we are, the point is to be able to provide regular feedback to policymakers so that can inform their thinking as they're kind of involved in this kind of fast-paced policy environment that continues to kind of evolve and change. So the use of evidence, evidence-based communication, so being able to provide really clear, robust evidence is a kind of fundamental part of this process. Using visual aids like charts and graphs can really help to convey complex data in a kind of more effective way. But also tailoring evidence as well. So different policymakers might prioritize different types of evidence. Some might value economic analysis, around cost savings. Others might be more interested in clinical outcomes or kind of organizational elements. So kind of understanding your audience in that way is really helpful. And this links back to kind of understanding policymakers' context as well, so that you know how to pitch something appropriately for the audience and the kind of institutional space that they're working within. Okay, moving on to the last three elements, and then I'm going to kind of pull it together, and then we'll have a breakout discussion about some of our priorities relating to this. So psychological insights, cognitive biases. So being aware of potential cognitive biases can help in framing research. So, you might think about trying to present data that focuses on more kind of short-term benefits, even though you kind of recognize that there are long-term future benefits, but those might be more difficult for people to kind of fully appreciate. Maybe there's a kind of present bias in some decision making. So there's a kind of a lot of psychological considerations around the way that research evidence can kind of be formulated and presented. And then emotional appeals as well. So emotional appeals within communication can be quite an effective tool. But I would encourage you to kind of think about using them quite judiciously. So you can combine kind of emotional stories potentially with solid data to make a compelling case, but you really don't want to appear sort of manipulative in the way that these kind of strings are pulled, if you like. And again, this links back to understanding your positionality and your role within this, as a kind of independent, objective researcher. And then insights from policy studies. So having some understanding of the policy cycle, which is the diagram on the right-hand side for those that aren't familiar, I think is very useful. Again, it kind of links back to this idea of policy making as being kind of linear and rational. The policy cycle is kind of a useful tool. It's a heuristic. Some of the problems occur when people treat it as if it is a kind of model of the way things actually work in practice, and generally it's not. But nonetheless, you can see sometimes how being able to time your communications potentially to coincide with part of the policy process that's relevant to the input of that information. So it might be something relating to kind of legislative sessions or budget planning or something, or you're trying to feed into an evaluation period. Just having that general awareness that there are different phases that occur within policy, kind of in a broad sense, and being able to sort of pitch and time communications can be really helpful. Often it's not possible to kind of have that level of insight, but it's something to bear in mind. And then institutional context. So recognizing the constraints and the priorities of the institutions that policymakers are embedded in can guide the development of recommendations that are actionable. So you might try and align research findings with current health policy goals or ongoing initiatives to try and make them more relevant, more salient to those policymakers, and therefore potentially more actionable. And then finally, practical recommendations. And we're going to kind of revisit some of this in more detail in the next part of the session. But just to kind of go through these briefly. Clarity and simplicity. So using clear, jargon-free language to ensure that your evidence is accessible to non-experts and non-specialists is really important. And that includes avoiding technical terms where possible, or explaining concepts in plain language. There's overlap here with kind of plain English summaries and PPIE work. You should not kind of assume any particular kind of expert knowledge, particularly if your communications are reaching a broad audience of policymakers. And then there's repetition and reinforcement. So repeating key messages, both within a single kind of communication output, but also between outputs and on various channels. So you might look at policy briefs. You might also produce presentations and media articles, and that kind of reinforcement can help to can kind of reinforce their impact, really. So having consistent messaging across those different platforms can help to ensure that information is retained, essentially. And then finally, feedback mechanisms, which is a tricky one, honestly, something that we grapple with in our work. I think for some areas of research, it's more straightforward. But a lot of the work that we do is it's a little difficult to kind of identify really clear X led to Y kind of impacts, but trying to establish suitable feedback mechanisms is important. So it might be surveys, it might be follow-up meetings, it might just be asking for some email feedback from policymakers if they can provide it, because you really want to understand how your messages have been received, see if there are adjustments that you can make, but also this kind of helps to inform this iterative process of really trying to ensure that your communication strategy is effective and it's responsive to policymakers' needs. But also kind of instrumentally for us as researchers, there is an importance in being able to find ways to capture impact of the work that we're doing when it comes to the ref and other sort of institutional processes for trying to understand and recognize this kind of impact of activity. Okay, so I'm conscious that's quite a lot of information, but I'm going to try and pull it all together and just emphasize that these 7 elements can kind of be thought of as working together rather than sort of discrete things. You can't frame effectively necessarily without understanding some context of policymakers. Having relationships can help you to tailor evidence more appropriately. You can support your practical recommendations through kind of psychological insights. And the way that evidence is used and engaged with is shaped by kind of phases of policy and institutional context. So really thinking about this as a kind of integrated approach to communication, I would say is a helpful way to go, and it's something that I found useful, which is why I'm sharing it. So I'd like to move on to a breakout discussion now. So if we can take 10 minutes here. I realize there's quite a lot of information on this slide. So I believe Tom can copy and paste this into the chat of the breakout rooms that you go into. So it's probably going to be around 5 people per room. Tom can confirm, but also if you want to take a picture of the slide that just has the information on it. The idea here is that I've tried to make this broad and open because, as I said earlier, I'm conscious that we'll all have different priorities, we'll be in different places, we'll have different levels of experience and reflections on policy communication already. So if you can just find which questions resonate most with you and try and give everybody an opportunity to just explore those briefly in your group, that would be great. So you can think about your priorities, you can think about the audience that you're trying to engage with, the approach that you're taking, particularly maybe reflecting on the elements of the framework that we've just gone through. And then any questions that you might have about, practical support or resources. Some of this stuff we'll kind of get onto in the next stage after this, but ideally we'll kind of come back together after 10 minutes and spend another 10 minutes or so just having brief feedback from each group, just maybe 1 or 2 key themes that you pulled together. If you can kind of nominate somebody to do that, and then hopefully Tom can help facilitate the kind of the feedback from the groups, if all that sounds okay. Is that all right, Tom?
Yeah. So the breakout rooms are randomly assigned. So they'll just pop everybody into it, and there's 4 or 5 of you in each one. So we'll have 8 different rooms, and I will paste the questions into the chat for each one for you. And you should be able to unmute and turn your cameras on now as well.
Brilliant. Thank you.
So 1 second, and you should all be moved into your rooms. All having left. So I don't know if you want to kick off again, Jonathan.
Yeah, sure. Thanks, Tom. Tom, what would you advise would be the best way to invite people from each group to feedback?
I suppose if everyone knows what room they were in, if you want to, we did ask for everyone to nominate somebody to speak. So I think the people have already been sort of chosen.
Cool. Okay, so perhaps those that are going to feedback from each group could maybe raise their hands using that function, and then I can kind of make sure that I get around everybody, if that's okay. And we've got about 10 minutes here before we move on to the next bit, but I'm hoping that we'll have some time at the end of the session as well for a kind of broader discussion as well, where we can pick up potentially some of these things in more detail. So I hope that's okay. Andrew, would you like to go first?
Hi, yeah, I'm delighted. So it was just a small group, me and Ishant, a chap. We were talking, and I'm not sure if this is what you were after, but it struck us that we both had areas of interest that we were looking to kind of promote, and there may be some confusion about exactly who to focus most efficiently our message to. Would that be somebody political? Would it be somebody who trains a group of healthcare professionals? Would it be all healthcare professionals? Particular subgroup of healthcare professionals, GPs, paramedics, nurses. We both have an interest in asthma, and who to reach out to be most efficient in our in promoting our message. Yeah, that was really what we were talking about.
That's great, thank you, Andrew. Yeah, I mean it's a perennial challenge actually, kind of figuring out how to pitch research findings, I think, to the most potentially when you have such a kind of broad group of stakeholders and people that you might that might benefit from hearing about it. So, you know, how do you prioritize, I think is what I'm hearing about that. So yeah, I think that's something we can potentially come back to as well as we kind of move through this, about kind of finding the right audience. So yes, I think actually, and sometimes from my experience, some of the research work that we've done has involved a kind of multi-pronged approach, if you like, to kind of engaging with policymakers and decision makers at different levels. So that's something to consider as well. But yeah, thank you, Andrew. It's great. Nathan, would you like to go? Can't hear you, Nathan. Are you muted?
Yeah, sorry, I thought I had clicked that. Apologies. So yes, in terms of the priorities, one of the people in our group was talking about wanting to, as they're going through their research, try to actually get better ideas of their stakeholders and drum up interest in the topic as they're going along, so that actually when there are results to be delivered, that actually effectively they've got identified and kind of built up interest in an audience, so that you're not really kind of coming up with lots of research and then no one then to present it, or no one that's kind of receptive to it. Effectively, so that was one of their priorities, particularly. So identifying and kind of pre-preparing an audience effectively for the research, what to deliver to.
Absolutely. I mean, I think that's one of the key things that I'd like to emphasize today, is that the process of engaging policymakers is a kind of broad, ongoing, iterative kind of building, you know, that might bridge between different projects and kind of develop over many years. So it's not helpful to just see it as something that happens at the end of a research project, I think, because you need to kind of tend the garden, or, you know, do the groundwork and kind of establish relationships and grow a network over time, I think. And then that creates other opportunities for sort of integrating communication into projects throughout the process. And that can help to address some of the kind of institutional differences that exist, I think, between policymakers and academic researchers in a lot of cases. So yeah, just I will continue to emphasize that I'd like to encourage everybody to think about this as a kind of a broad project that's kind of ongoing, and not just something that happens in a discrete part towards the end of a project. But yeah, thank you, Nathan. Catherine.
I'm nominated myself, so we didn't get around to deciding, but hopefully nobody minds, and feel free to pipe up if you want to add. So we had some people who were quite early in their research journeys on a particular topic. So there was stuff around improving the way GP surgery works and traditional roles in GP surgeries and easing the workload of GPs, some stuff around dementia services and improving that experience, for example, and somebody working on out of hospital to community care for optimizing respiratory care in the community. They were all quite early stage. I think they were talking very much about just kind of knowing where to start when you know you will have really useful things to share with the right stakeholders by the end of your work, but feeling a bit overwhelmed by what do I even do in the first instance to start to engage stakeholders so that they're kind of ready to receive messaging by the end. And I think myself and another person were perhaps a bit further along in areas of research, but still kind of feeling perhaps a bit overwhelmed by where to go first and what might be the best approach. Especially, I guess, as researchers, we're often quite limited on our capacity and our resources. Workloads are high, so you kind of want to get the most bang for your buck, I think, out of the activity and the input you're able to put in. So yeah, any sort of tips or advice around optimizing your approach would be grand.
Yeah, really important question, because I think it can be overwhelming, the sort of the different options that you have for trying to find a path through to communicating with policymakers. Hopefully some of what we're going to talk about in the next half an hour will address some of that. I think particularly around engaging with the kind of policy units or institutes that exist in a lot of the universities that make up SPCR. They can often be very helpful in kind of facilitating access to the right people at the right time and helping with communication style. But yes, I think I suppose that kind of relates to the last point in that, once you start to kind of establish a network and you kind of know who some of the right people are to talk to in the space, if it's government policymakers, potentially the right departments, etc., then that kind of that more kind of interpersonal knowledge makes that process a little bit easier. But yes, I think the initial stages are tricky, and it's often about trying a variety of different things and kind of pursuing them all and then seeing where that leads you. But yeah, as I say, hopefully some of what we cover next will speak to that in a useful way. Thank you, Catherine. And Laura.
Hi, John. Sorry, we didn't nominate anyone either, so I'm going to jump in and just say that we were also discussing issues around access and how do you actually find policymakers who want to hear about your research. And just briefly, we had a discussion around the challenges of communicating complexity and uncertainty, which is often what research findings look like. They're not usually a simple pat answer that you're communicating to a policymaker who's all ears. And we talked about the nuance a little bit of that and how useful it would be to know how to package that and communicate it in ways that would be acceptable and useful for policymakers. So that's what we were talking about.
Yeah, it is tricky, isn't it? Because you know, on the one hand, you have to try and make things sufficiently kind of streamlined and accessible, and you don't want to kind of do a disservice to areas where there are uncertainties and ambiguities. But then you kind of can't foreground that often because you don't want to kind of detract from the message. So I think it's a skill to kind of balance that, and it relates to each case individually as well, given on the area that you're working on. I think sometimes being able to sort of point to kind of additional information, if it's kind of links, you kind of even flagging things in footnotes and saying, there is more information that can be kind of considered here, but trying to just pull out headlines that are less equivocal where possible, I think is useful. Again, I hope that we'll particularly thinking about policy briefs and the kind of approach to writing them and structuring them, presenting information. We'll go through that shortly. And I hope that that will kind of address that to some extent. Is that all right for now, Laura?
Perfect, thank you.
Yeah, thank you very much. Okay, I think that's everybody. So thank you all very much for that feedback. I appreciate it. It's a very open kind of request to discuss things in that way. But yeah, hopefully it's now going to kind of tee up some of what we do in the last bit. And as I said, I'm going to attempt to get through this while leaving enough time for questions and discussion at the end. So let me just get us back to the right place. Okay, Tom, can I just confirm that that's all working as it should be?
Yep, all working fine. Everybody, you are now muted again. But if you have anything urgent, you can put your hand up, and remember to pop any questions in the Q&A.
Great. Thank you very much, Tom. Okay, so yeah, we're kind of moving into the more practical applied space here, I would say, and particularly thinking about the framework still, what that looks like in practice. So what are the things that make communication policymakers challenging? What do policymakers often actually need? How can you particularly write effectively? And how do you go about choosing the right format and channel for those communications? So thinking about challenges, first of all, it's probably abundantly obvious to most people that policymakers and researchers tend to live in quite different institutional spaces. We have different kind of modes or tendencies in communication. There are different timeframes around kind of producing policy and producing research outputs and academic outputs. Often policy spaces move much more quickly. We have different languages that we use. You know, we have different metrics of success, and all of this kind of creates bridges that we need to think about how we can cross in order to sort of speak effectively to policymakers. And I say that because I think really the onus is on us to find ways to kind of fit into those institutional frameworks of policymakers where possible. I mean, I've given the example already of this research update group that we have on the 22 Act project, and that is it is an attempt to try and bridge some of those particularly differences in time frame, and that's led to us actually conducting the research in a way where we're doing a lot of the analysis kind of concurrently with the data collection, so that we're in a position to feed back a bit more responsively to policymakers at those meetings when they occur. So there's a whole range of different considerations here, and we'll talk a bit more about the language as part of that as well. But this kind of leads us on to thinking about what policymakers kind of tend to need. And in general, this is a kind of a very kind of generalized sort of characterization, really. Generally, it's around clarity over comprehensiveness. Again, thinking back to time pressures and cognitive overload, it's about providing solutions or options and presenting those rather than reams of problems, and similar to the point that was made, also just complexities, which we often like to grapple with, but aren't necessarily the most helpful things for policymakers at all times. They often prioritize timeliness over perfection and good enough sometimes, particularly when doing, you know, an evidence summary or something. It is better than it taking too long and missing a deadline for those policymakers. Things that are relevant to the current agenda, insights that are potentially actionable are very helpful, and having some brief evidence of credibility. Again, it comes back to your relationship with them. They may know who you are, they may already recognize that, but being able to flag what makes you kind of authoritative in some way to speak to what you are speaking about is very helpful. So really, it's our job to act as a kind of editor, to identify and present the most useful information possible in an accessible way, make it really obvious what the so what is in what you're presenting, I think is probably one way to put it. The 3 C's, so trying to make things clear, concise, and contextualized using simple language, a logical structure that's accessible, having your key messages up front, really helpful. Again, acknowledging and respecting people's time constraints, being quite ruthless in how you prioritize what's presented. Again, depending on the format, and we'll talk a bit more about format shortly, but you know, you really need to focus in on what the key things are and kind of get rid of the rest often. Contextualized, so you know, connecting current policy agendas and priorities. This doesn't mean taking some kind of partisan line. It's probably very obvious, but obviously, you know, our role as kind of independent researchers and producers or curators of evidence means that we can be sensitive to what political priorities may be without kind of stepping into a territory where we could be seen as endorsing particular political perspectives or narratives. And then understanding your audience. So it's a question really to ask yourself when you engage with policymakers each time, you know, what's the intended audience? What different pressures might they have on them, given their sort of level or the work that they're engaged in? For ministers and kind of senior officials, they're often thinking about broad strategic issues. They may have less time to go through detail as well. Civil servants or policy analysts may appreciate more detail or more kind of integration of a range of evidence into what's presented to them. Local commissioners and managers, they may require kind of more locally relevant applied information. And we've had projects where we've produced kind of similar outputs, but one for a more kind of implementation level and one for an evidence synthesis level. And we've kind of found ways to sort of change the language and the emphasis slightly to try and preempt what we think is most salient and most kind of relevant to those different audiences and the way that they might engage with that information. And again, this is the kind of sensitivity to these issues is something that you can build up over time, along with your kind of your network of potential policymaker stakeholders and your kind of audience in general. But thinking about what do they need from you, what decisions are they facing, and what's their prior knowledge, they're all really useful things to consider, even if you don't have complete answers to any or all of them. And then how you frame your message as well. So leading with policy relevance, not research process. Generally, policymakers are not super interested to read about methodology. Again, it kind of relates to you need to be in a position to present information as a credible authority. And actually, a lot of that stuff is kind of taken as read that, you know, you've done good, solid work, and you're presenting them with the relevant outputs. To re-emphasize framing things as opportunities, as solutions, not just problems. Using narratives and stories strategically, as we talked about earlier, you know, there is a line to walk around the way that narratives, particularly emotive kind of material, is used. But connecting to existing policy priorities, I think, is always a key thing to consider. And sometimes it's about finding the right kind of hooks as well. And that can be a bit of an art rather than a science, because you're almost looking ahead really and thinking what the policy priorities might be based on the kinds of kind of what's happening in the kind of political space in general. So that kind of framing can be quite a creative process, really, and you might not always land it correctly, but you're trying to find a way to cut through to a policymaker to make it clear to them, like, this is relevant to me, like this, I should pay attention to this because it might contain something that can help inform something that I'm working on now or that is likely coming down the track. So I think it's really about salience. One of the things that we've done in our general practice access work is to kind of think about how we ensure that the work that we're doing, the conceptualization of access is quite relevant to not just access as a policy priority, but also continuity as a policy priority. And kind of the framing then incorporates those elements together, which sort of helps to really package it in a way that hopefully is kind of more salient and more meaningful to policymakers than it would have been otherwise. So I just want to focus on a policy brief in a bit more detail as a particular output, because it's common and it's useful, I would say, to kind of a range of audiences, and it can be tailored in different ways in terms of length, in terms of the level of detail, etc. And I'll show some examples of policy briefs that we've produced as well. So for those that don't know, a policy brief is generally a pretty short document, kind of 1 to 4 pages max usually, and it's translating research into potential policy action. And it can be used in a variety of contexts for a variety of purposes. It might be responding to consultations. It might be kind of engaging proactively with policymakers. And kind of just producing it to give to them, kind of our own backs. But it could be something related to post-publication of a paper as well. So, you know, it's another way of turning kind of published evidence into a different format for a different audience. But the core components generally are around an executive summary or some key messages. So it's kind of assuming they might only read the first bit. So you need to kind of foreground all of the key detail in a very digestible element at the top. There's some context settings, some problem definitions, kind of like why this matters. A summary of evidence, again, minimal methods, really focusing on findings, and then the policy implications and recommendations. And finally, having something that speaks to your credentials, contact information, so that they can reach out for more detail if necessary. And just as an extension of that, sometimes it's useful to think about these types of communications as this kind of inverted pyramid. You have the most important information first. You assume that readers might stop at any point, and you try and include headlines and subheadings to kind of break up the text to make it visually not overwhelming and kind of it's easy to signpost to kind of relevant sections. Bullet points to summarize is helpful at times, but short paragraphs, potentially kind of pull out boxes for key statistics, quotes, or elements. And just to reiterate on language again, using short sentences, trying to avoid jargon where possible, minimal acronyms as well, like only if you're kind of using the same acronym multiple times. I think you really don't want many. You don't want to create that work for people to kind of think, well, what does that mean? And looking back to earlier in the document. Defining only essential technical terms, using specific examples over abstract concepts. If you're doing the kind of research that allows you to quantify things, you know, including that, I think often policymakers are quite enamored with numerical evidence. And then removing caveats from the main text. This speaks to Laura's point earlier. So I think, you know, including things in footnotes where it's important, but trying to find that line of accessible and impactful information whilst not, you know, discounting any significant areas where there is kind of ambiguity or qualification that needs to be considered. So again, specific actionable recommendations, including different options with trade-offs, considering flexibility and cost where possible. Often that's quite helpful. Linking to existing policy levers. Try and avoid kind of just saying that more research is needed. Trying not to provide recommendations beyond your evidence. Really the recommendations you provide need to be rooted in what's presented, which may be abundantly obvious. And don't ignore the political and practical realities. There's very little point in proposing solutions that are so fantastically disconnected from political reality. It's just a complete turn off for anybody reading it because it feels so unmoored from reality. And then there are a range of other communication formats or modes that you can consider. So I'm focusing here on policy briefs particularly, but then a lot of the points that I've made don't relate specifically to policy briefs. They're kind of relevant more broadly. You might produce policy commentaries or evidence summaries. We do a lot of those in our PRUCOM work. You could have shorter kind of one-pages or briefing notes that are kind of a more condensed version of policy briefs. You might respond to consultations, you might submit evidence to inquiries. There's opportunities for kind of writing editorials or blog posts, and often that can be quite an effective way of reaching a broader audience. For verbal communication modes, there are often opportunities for presenting expert testimony to committees, briefing meetings with officials, roundtables and workshops, conference presentations, if the audience is kind of including policymakers. We presented evidence to MPs and to members of the House of Lords. That was facilitated through Policy at Manchester, who I'll talk about shortly. And that actually is a really interesting experience to try and figure out how to conversationally kind of do a lot of the same work as a policy brief. And obviously it adds another dimension to it, having that kind of face-to-face encounter. Visual communication, so infographics, visualizations, short videos and animations, some of those things can be incorporated into the other written formats. As I pointed to with our kind of Oath website, we've used videos and animations, and we've also used kind of infographics and figures in some of our policy briefs, and I'll show you one in a moment. But I think for choosing a mode, it's worth thinking about, as I've mentioned, the kind of seniority of the audience, the complexity of the topic, a relationship that you may already have with the recipient, but also there are kind of considerations around urgency, whether there's inquiry deadlines or relationship building that is kind of happening. But a multi-channel approach can be really effective. Repetition and reinforcement, again, is a very useful tool to consider. You might find it helpful to look for calls for evidence and inquiries. So it's worth checking Parliament UK and Gov UK. There's some guidance on Parliament UK for providing written or oral evidence to House of Commons select committees. And there are often calls that are relevant to all of us working in this kind of broad space. I had a look on the website, and there's currently a call for evidence on egg donation and freezing. So this just gives you an idea of the kinds of, it's usually a series of questions which you're asked to kind of address. If you kind of reference the document on the previous slide, you can see how to present that. There's an example here that some colleagues produced. I don't know if you can see that very well, I'm afraid. But I will share the slides after so you can have a look. But this was around a response to a call about reorganization of the NHS, the different sort of spatial levels or tiers and the organizations that populated them and their responsibilities. So it kind of starts off by establishing credentials and the kind of work that our team have done in this space, and then kind of breaking down, responding to the questions. You can see lots of bullet points, bold used to kind of emphasize certain things. So that's kind of its own mode in itself, but it's really worth looking for relevant calls for evidence, because often it can be relatively accessible to get your evidence into a select committee inquiry, and it's just a useful practice, and it's a useful kind of impact as well. So there are a range of communications and engagement support and resources. So for us at Manchester, we have Policy at Manchester. It's our engagement unit, and their whole remit is to get research evidence into legislation, regulation, and policy agendas. And they do that through various channels, articles, blogs, publications, calls for evidence responses. There are similar units in other universities. I think all of the universities within the School for Primary Care Research have something similar, although I haven't looked in great detail at all of them. So I really encourage you to engage with those units. They can facilitate, they can support your development of communication, but they can also facilitate access to the right people. So it's very much worth doing. Also, would encourage you to look at the Parliamentary Office for Science and Technology. So they do these post notes, which are kind of 2-page briefings for lay audiences. They're very effective. They're quite useful just to look at to get an idea of how they're structured. And then the OHID, which is the Office for Health Improvement and Disparities, can often have some useful information about current health policy priorities, and they kind of monitor data releases and reports as well on there. Here's a quick example of a post note. So this has, you can see a clear headline with policy relevance. There's a link to further detail and a full report. There's this very short kind of a few bullet points that are easy to scan, showing you the kind of benefits and issues, showing the context and the specific timing. So go and have a look at some post notes, I think would be my advice. And then here's an example of a policy brief that we produced on our GP access work, which we were supported by Policy at Manchester with. So you can see there's this condensed summary or call out at the top. So even if they just read that kind of purple box, that's giving them most of the information that is important for them to have. And then there are these in summary sections, which is scannable bullet points, an in detail section, which has relatively short paragraphs, but also hyperlinks, bold and kind of colored text to draw attention. And as I mentioned before, we kind of incorporated a visual diagram to sort of just support the kind of understanding of the content. And then we've got a section on suggestions for policymakers, links to resources, and then some brief information about kind of credibility and contact info. As I said, they also do these kind of articles and blogs, Policy at Manchester, and we've produced some of those before. That's a really helpful way of kind of getting the ball rolling with policy communication, I think, and learning to write for those kind of different audiences. So to conclude, I'm just kind of revisiting those elements of the framework that we looked at earlier. So that's really just summarizing the kind of key things that we've covered in this, and I've tried to reiterate. So I'm not going to read through them all, but again, kind of have a look at the slides after the session and reflect on the relevance of all of this to your own work. And then I'd just like to encourage you to think about some kind of practical next steps, and maybe kind of think about what can you do this week or this month or over the next 12 months. So there's some suggestions there. Certainly kind of signing up for policy alerts is a good one. Looking to submit one piece of written evidence to some kind of inquiry or call, I think is a good one. But really engage with any policy units that you can engage with. They can be extremely helpful, and really kind of you can learn a lot from them in how they engage with policymakers and communicate with them. So these are the references for the papers that I've mentioned. My email address is on the first slide, so please do get in touch if there's any questions that you have or any feedback. I'd appreciate it. I'm going to stop sharing. I'm conscious that there's 5 minutes left, but if anybody has any questions, I'd be happy to take them. Thank you.
So we have a few questions in the Q&A already, and a couple in the chat. So is a publication a prerequisite to writing a policy brief?
That's a good question. Generally, I would say, part of the process of kind of demonstrating credentials is almost kind of having some presence in the sort of academic space through publication. But it might be that, actually a policy brief could major on synthesizing existing evidence, and that can be a useful kind of a useful output in and of itself. So not necessarily. I think it partly depends what the intended audience and purpose of the brief is as well. But I think the more that you can kind of demonstrate a track record of kind of doing the work within the space that you're speaking to, then probably the more helpful it is in terms of policymakers kind of establishing that level of trust with what you're presenting.
Brilliant. From Catherine Brown, often we need to get the knowledge mobilized before publication. Publication can take around 2 years in some cases, and policy just can't wait for that. What would your tips be for managing?
Yeah, again, it's that challenge of timescales, isn't it? It's a very different time frame for publishing academic outputs than it is for responding to policy in a given area. So I don't have a definitive answer for that. I think it's a challenge. It's something that if you're working in a kind of broad space over time, then you're kind of establishing yourself by having a level of publication within that field, which is then helpful to allow you to respond more quickly to things as and when they come up. That also shouldn't prevent you, if that doesn't exist, that shouldn't prevent you from engaging with policymakers and communicating when you know that you have something important to share and impart. So it might be that there are other avenues that can kind of create that or establish that presence that
Oh crap! No, not tomorrow. I meant today.
That are quicker than some of those
Can't do tomorrow.
particular modes. So it might be that you're kind of looking for blog outputs, or it's quite a case-by-case basis, I would say. But yeah, try and establish that presence in a field, but also don't let that put you off and look for other avenues to kind of establish that presence in a shorter time frame.
Brilliant. Catherine, you did have your hand up. I have given you all your mics and cameras back. If Catherine, if you had something you wanted to add.
It was accidental because I was trying to put my thumb up, but then I have got another question in the Q&A anyway, which is, have you got any tips for how you kind of track the impact once you perhaps put a policy brief out there? Just knowing how that's kind of been picked up and used, etc.
Yeah, I mean the question of impact is something that we really grapple with, particularly with the type of research that we do, which doesn't generally lend itself to, a new hospital strategy was developed or something similar. So for policy briefs, generally they are kind of disseminated by Policy at Manchester on our behalf. So they support us with their development and then they circulate them. And so they track kind of engagement with those briefs over time, which is very helpful. But then more broadly, I think, trying encourage policymakers to feed back to you if something was useful, even if it's just a really short email that sort of says, you know, we've used this for this and it was helpful in our thinking, you know, just trying to find avenues for capturing, however informally, alongside the kind of metric stuff around X number of people downloaded this document.
Yeah, because that only gets you so far. It's like, oh, they downloaded it, but what did they do with it? More details needed often, isn't it? Thank you.
Yeah, you're welcome. It's a challenge, and I'm keen to hear if anyone has any really good ideas about how to do that effectively.
Me too. Please share.
Thanks, Catherine.
Laura Jefferson, I think your question has already been answered, but if you did want to expand on it at all, I think that was about getting research published to add credibility, but also within the time constraints of the political space. Feel free to add to that if you think we need to expand. And if anyone else does have questions, one more from Amy. Do you find that policymakers are open to qualitative approaches? And how would you approach providing more qualitative research without making the findings more quantitative appearing?
Yeah, I mean, I should have said I am almost exclusively a qualitative researcher, although I do a lot of work on mixed methods projects. Policymakers are open to qualitative findings, in my experience. The key thing is to show the relevance to their priorities. And that might be different for different policymakers, for different teams, analysts from different departments, etc. So I think, you know, you need to make it clear that what you've done is kind of sufficiently rigorous and relevant to kind of addressing the questions that you've set out to address, that are also the questions that they're interested in. So it depends, I guess, depending on who you're engaging with. But I would say in general, we've found policymakers to be quite open to kind of engaging with qualitative evidence and taking it seriously.
Brilliant. Any last questions from anyone? Feel free to pop them in or pop your hand up. If not, I think that might be everything.
Great. Well, thank you so much for being here, everybody. Really appreciate it. And sorry, the questions were a bit rushed. As I say, feel free to reach out to me. We'll share the slides afterwards. And best of luck with your policy communication endeavours.
Great. Thank you for coming, everyone. And thank you again to Jonathan. That was a brilliant session.